Thank you for giving us this knowledge even yesterday, and as we are about to continue today, we pray that grant us understanding.
We are here because of a few key words: universal health coverage, and the CHIPS, that's community-based health planning and services, and the need to have a way of checking what is happening at our community level in terms of the health services that we are getting. So it's a new kind of initiative to get people to assess the service centers at the CHIPS compounds, including the services they are rendering. And without the community, it won't work. So we are here to kind of be the kind of gel between the community and then the stakeholders. But then we are community stakeholders ourselves. And a lot more will unfold as we go on. But then let me now call on Dr. Charity Binka, Executive Secretary of AMMREN, to give us the opening remarks.
How many of you know about AMMREN? You don't. So many years ago, in fact, 2000, in the year 2000, they met in Lagos and we were talking about malaria and how they wanted to end malaria. In how many years were they going to end malaria? I can't remember. But today, malaria is still with us. But they started this, the African leaders met in Lagos to tackle malaria. And then, so that's how the alliance came about, and then gradually, I'm sure the AMMREN person will be telling you about it. But one of the things that AMMREN decided to do was to score countries in terms of health delivery, because the scorecard initiative is a very powerful tool to make sure to keep an eye on the duty bearers. I think most of you, you know about CHIP compound, don't you? How many of you, who is here who doesn't know about CHIP compound? All of us. Then our work is done, we can close and go home. Anyway, so we have been on this journey since I think 2002 or so, or even more, talking about, AMMREN got involved in this whole idea of the big project that they are doing, funded by the French government. If you look on your left, you see the name of the actual organization, Expertise France. They are supporting the Ghana Health Service to make sure that they strengthen the health system through the scorecard system initiative, the Community Scorecard. We have had the opportunity to engage in this, watch this whole thing about the interface sessions, where the health workers, after the scoring, they have the duty bearers and the right owners, that's the community members, they meet. And then there's a lot of engagement. And I'm hoping that those of us in this room who will be going to the field after this training, you will have an exciting time and something that you will look forward to. We'll be discussing that further. But for us, African Media and Malaria Research Network, we are really very grateful to our partners, the Ghana Health Service, France, Expertise France, and AMMREN for getting us on board. When the journey started, they felt that the media was very critical in this whole discourse. Because if we did not tell the story, nobody would know. It is all to be within the health system. And then we go and maybe then the duty bearer said, this is you have not done this, you have not done this, and they will say they have. I was part of one in a home where they brought a national health insurance guy. It was such an interesting session. The national people, the people said that they've been cheating them when they want to renew their insurance. People take money from them. Some were not able to go online. This app, they don't know anything about it. So when they reach out to them, they say you have to pay something. Sometimes they have to travel quite a distance to go and renew your card. Some of them didn't even know that when it expires, and even if you go and renew it, it takes at least 1 month for it to kick in. So they didn't know all that. And the guy was standing there, he was sweating. We had to rescue him because it was really very hot. Everything they said, they shouted, oh, it's not true, shut up. It was very interesting. I think that is the whole beauty of what the scorecard is. And we, the journalists, we think that we should not be left out. So our coming here this today and maybe part of tomorrow is to be able to understand what this whole community scorecard initiative is about and the role that we are supposed to play. We are supposed to not go and report, but be partners in whatever we are doing, which means that we need to even follow them. There are going to be series of training across the country for the Ghana Health Service staff and other partners who are involved in the project. And we expect that our journalists or we too will be there to be part of the history making, to change the story about the health systems so that we all have a universal health coverage. That is why we are here, and I'm hoping that we will all be present. Sometimes we are here, but we are not here. Our smartphones will take us away, our laptops and all that. But please, it's just 1.5 days. So I want us to pay attention. Because if we really want to change the health system in this country, journalists must be part of it. Why am I saying so? If surveys that have been done across the country over the years show that many people get information about their health from the media. People go and buy medicine because they've heard an ad, they've listened to, or they've heard an advert on radio, or they watch something on television, or some advert on television. He says that we should do the entire BI and all those people. So we make informed choices based on what we hear and what we watch, which means that it's very important. The media plays a very important role. And if we get it wrong, everybody will get it wrong. When we got it wrong, for instance, during this one doesn't have anything to do with the scorecard, but the way we're having they were talking about the malaria vaccine. People were going around saying all kinds of things. And at that time, people got confused. People also even got confused during the COVID-19 pandemic. When some people said the virus hangs in the air, some people say it's several meters away. Some people said it's on the surface, it stays on the surface of tables and this. Even the health people got it wrong at a point, and we were all running around so scared. As soon as you got anywhere, somebody called, you are afraid that you are going to get caught. So we play a very critical role, and we cannot downplay it. So the whole idea is that let's be part of this whole initiative. Let's send the message across that we can do something about our health system. The duty bearers who are the those who provide health service or health care, they also have a role to play. Community members also have a role to play, because some people, they refuse to obey instructions as to what they are supposed to do and what not to do. We are hoping that after this program, we will be able to pay attention. Those of us who have not been visiting chief's compounds, we will visit. Those of us who have, there's a new initiative called community of what? The network of practice. It's a new initiative the Ghana Health Service is pushing, the network of practice. We'll be hearing about that one also, because that one involves all of those healthcare providers and the health service. We will get to know about that one also. So please, this is a learning care for all of us. I am also going to learn a lot more, and I'm hoping that we'll all be part of this, and that will carry the message that if you do this, if the health workers are not doing their work, we will be able to draw attention to it. They are open. The system is so open that they can't hide. Everything is online. Everything you can see also what is happening on the grounds, so that we can get the messages across. So I want to end here by saying that you are all very welcome. It is a noble cause we are pursuing. We want nobody should die because of because the health system is weak, or because we cannot access health. That is what the universal health coverage is all about. To get there, all of us must play our role. The media must get the information out there where people can get service. And if somebody is not doing something right, we should draw attention to it. So that, and then if the community members also are ignorant about what is expected of them, we should be able to draw attention to it through our reporting, through programs, television programs, radio programs, our opinion pieces, all the things that we put on Facebook and all that. So ladies and gentlemen, I am excited, and I'm looking forward to a very exciting and very engaging time the next 1.5 days. Thank you very much, and God bless us all.
It's been led by the African president. Currently, is the president of Binka, who is the president of AMMREN. And we support countries to develop these tools to propel the health strategies. Obviously, starting with malaria. So we started with the malaria scorecard. And it's proved to be very effective in propelling the malaria agenda. So the former UN Secretary General Ban Ki-moon recommended that the same strategy be employed for RNCAH. So when we say RNCAH, we're talking about reproductive, maternal, newborn, child, and adolescent health. Because it was realized that maternal mortality was very high in Sub-Saharan Africa in particular. The neonatal mortality too was very high as compared to the global average. And most of these bad, unfortunate indicators are recorded in Sub-Saharan Africa. So the African Union needed to do something about it, moving away from the usual business into tackling things pragmatically in order to accelerate the reduction of maternal and newborn deaths. So that's why all these interventions came in. And we think that the media is very central in the reportage, because the media can report something that is good as bad, and something that is bad as good. So, but you can't blame the media. At least you need to involve the media in capacity building to understand what it is all about, so that together as partners we'll be able to achieve the objective we have set before us.
We think that our health workers, they are not too disrespectful, they are not also too respectful. And then the reason for why we voted 2 is as a result of individual differences. You may go to the hospital and meet nurse A. She might treat you well. You meet nurse B and he treats you bad. And so we can't say it is the entire facility. We also consider the age of the health workers. probably the health worker is not an elderly person, or depending on how the person is brought up. We also considered mood swings and the personality, or sometimes the health worker also consider the personality that visited the facility and treats the person according to what he or she thinks. And we also, so these are the reasons that we voted for average when it comes to caring, respectful and compassionate care. And our second indicator is waiting time for provision of healthcare services. And so that one, community members says that it is very, very bad. The waiting time is very bad when you come to our community. And the reason is that one of the community members visited the health facility, and the health worker who was more addicted to social media, was so much on her phone to the detriment of the sick person. We also looked at the bureaucratic nature of the health services. You go to the hospital with a pressing issue, and the health worker is seated there and says, go and take your vitals before you come. And so it made some of the community members delay so much at the hospital. We also considered insufficient staffing. Our community has only one health worker, and so you go there and the sick people are more than the health workers that are there. And one of the reasons why community members goes to this facility and they keep long, or the waiting time is very long, is because of protocols and who you know. Sometimes a community member, a vulnerable community member who goes to the facility and doesn't know any person, goes to sit there whilst other people come late, and because they have a good relationship with the nurse, I mean, they are giving chance to enter. So these are the reasons why we voted bad. We voted 1 for the indicators, the waiting time.
So this is group 2. We are looking at indicator 3 and of course indicator 4. And the 3 talks about availability of medicines, diagnostic services, and medical supplies. And after the discussion and deliberations from our various places, of course, looking at what is happening in our constituencies and CHIP compounds, we voted 2, meaning that majority of us, after the discussion, agreed that the availability of medicines and diagnostic services in our various areas are not, they are just average. So that's why we voted 2, and about 8 of us voted for the average. So that is it. When we come to the reasons, that's the reason we assigned to why we voted average, is that medicines not always available. So it means that it's not that there are no medicines. Medicines sometimes are there, sometimes too they are not there. So the frequency of medicine being at the facility is not assured. Many times it's not available. Indicator 4, that is also looking at availability, accessibility of quality of health care service and infrastructure. And of course, when we say availability, we are looking at availability of the zones or the CHIP compounds. Accessibility, how accessible is the zonal group, that's the people within the zone, and the quality of healthcare services being delivered at the facility, and of course the infrastructure. There too, majority of the community members voted average. And the reason assigned is that although there's availability of the facility, the CHIPS compound within the area, health workers are often not available. Sometimes you go in the evening and they are not there. You don't know the reason. There's an instance where your community, Gonja, maybe a teacher had a situation where a child or a student had his hand caught. He had to rush the person to the facility. Nobody was there. He has to rather go back. So these are the reason why we have to, we voted 2. And even the nurse said that instead of bringing the child, they should rather take the child back to school. And we think that, of course, there's a problem there.
If we are saying that people rely on the media for health information, then we need to equip the journalists to be able to report adequately and to be able to seek information, to find out from the people, to question people, to seek accountability from the duty bearers. So I don't know. So we at AMMREN, we are very excited to be working with the Ghana Health Service to push this agenda that journalists are critical to the whole process. And if they just see us as journalists and people who come and report, then it is a big loss of opportunity. And that is the missing link for me. For AMMREN, the missing link is that the media is not that effectively engaged in the process of the healthcare delivery. And the key to universal health coverage is the Community Scorecard initiative, where everybody will be on his or her toes to make sure that what they are supposed to do, the healthcare providers and those who are receiving, and also sometimes we always complain about the community. Sometimes we always complain about the healthcare providers, that they are not doing this, they are not doing that, they are not doing that. But sometimes we have a problem with the community also. Because of our belief systems, people don't even, some diseases they think it's the visitation of the gods and all those kinds of things. And so where they are supposed to go and seek help, they don't go until it is too late. So when you arrive there, you don't get the care you need, you die, then they blame it on the healthcare providers. So we also have to deal with the issue of ignorance, our belief systems, traditional practices, and the kind of, we resort so much to herbal medication. We are not saying that our traditional medicine is not good, but how much of what do you take to be able to treat a disease you don't even know what is happening to? So we need to work on community members as well to be able to seek help when they need it, to be able to go to the health centers when they at the right time. You don't wait until it is too late. Then you blame somebody. So there's a lot of work to do. If indeed we want universal health coverage, then both the people who are providing the service and those who are receiving the service need a lot of education as to what to do, because we all have a responsibility. Those who are providing the care and those who are receiving the care. And we also have a responsibility to speak up when people are not doing what they are supposed to do. And that is the job of the journalists. We are the eyes and the ears of society. We must be present when it is happening real time. And we are hoping that after this training, there's going to be a lot of training at the health centers across the country. And we are hoping that the people who are here will be assigned to this the other partners who will be doing training, will be assigned to the partners, will be part of the training programs. And then the journalists also have the opportunity to go to the field themselves, to see for themselves, independently, to gather information, to find out indeed what people have said that they are going to do, are they doing it? So it's a whole package. We are hoping that we'll be able to do some kind of webinars and all that, so that we are all engaged.